All right. Good morning, ladies and gentlemen. Welcome to today's seminar, December 27th, 2020. I am Putu Cintya Paramitha, and this is a really precious chance for me to be your master of ceremony in this seminar articles entitled Measuring and Understanding COVID-19 Pandemic. In this great occasion, let me extend our highest gratitude for the opportunity we have together here, so we are able to attend this seminar. There are a lot of participants who are willingly attending this event to share their ideas and discuss issues related to the topic. So, thank you for your participation. I hope that we will learn a lot and get a lot of useful information from this seminar. Well, before we start the seminar, let's pray together. I will lead the prayer. Pray begins. Pray finish. Well, ladies and gentlemen, let me read you the agenda of today's seminar. The first agenda is opening. The second one is presentation from the speaker. Next is the discussion session. And the last is closing. Ladies and gentlemen, during this seminar, we will guide by a moderator. So after this, I will give the chance to the moderator to introduce herself as well as lead this seminar until the discussion session. So for the moderator, the time is yours.
Thank you, MC. Swastiastu. Good morning, ladies and gentlemen. First, I say thank you to the audience who have put yourself to attend and join into this event. I hope all friends in a good condition. It is a great honor for me to be here to meet you all and have this nice opportunity. I am Maha Bhagavati Devi Dasi, as the moderator of today's seminar, who will chair this session for the next few hours. The topic of today's seminar is about exploring and understanding the COVID-19 pandemic. And as you know, we will have 5 speakers who are going to present 5 related topics. The speakers are Gusti Ayu Ira Krishna Santhi, Kadek Anggi Pratiwi Anugraha, Niloh Kadek Wiwik Kartika Dewi, Putu Eka Pramesti, and the last one is Juliarni Nalisaputri. To make the seminar runs effectively, the 5 presentations will be done at once at the beginning for about 5 minutes for each speakers, and the rest of the time, which is about 1 and 15 minutes, will be utilized for discussion session. Ladies and gentlemen, the presentations are started now. Please welcome the 5 speakers. We will invite Gusti Ayu Ira Krishna Santhi, Kadek Anggi Pratiwi Anugraha, Niloh Kadek Wiwik Kartika Dewi, Putu Eka Pramesti, and Juliarni Nalisaputri. Before that, in this seminar, there are any rules that must be followed together. Number 1, participants are expected to develop the microphone while the speaker is exposing the material delivered. Number 2, for participants who have questions related to material delivered by the speakers, are welcome to click the raise hand features, and participants are on to submit the question directly to the speakers. Apart from that, participants can also write the questions through the live chat. And the last one is, for the delivery of materials from the speaker will be given a time of 25 minutes, and discussion session given a time of 15 minutes after the speaker has completed the material. Well, ladies and gentlemen, the first speaker is Gusti Ayu Ira Krishna Santhi. She is from Alasankar, Buleleng. She was born in Denpasar, 12 April 2001. Education, elementary school at SDN 2 Alasankar. Junior High School at SMPN 5 Singaraja, Senior High School at SMEN 4 Singaraja. She was Bachelor of English Language Education in Ganesha University of Education, and now she is of the member of World Health Organization. Well, we listen immediately to the exposure of the materials from Gusti Ayu Ira Krishna Santhi. Time is yours.
Okay, thank you, moderator. Thank you for the opportunity that has given to me. And good morning, everyone. It is an honor to be your speaker in today's seminar. As mentioned by the moderator, my name is Gusti Ayu Krishna Santhi as the first speaker. And now I will share information or share my knowledge about the definition of COVID-19. So what is COVID-19? As mentioned by WHO, coronavirus are a large family of viruses that can cause respiratory infection. This can range from the common cold to more serious disease. COVID-19 is a disease that caused by a new form of coronavirus, or it also can be defined as an illness that caused by a novel coronavirus and now called severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. It was first reported in December 2019 in Wuhan City in China. It was confirmed spread to Indonesia on March 2020. The outbreak spread quickly across the globe for the first month of 2020 and declared as a global pandemic by World Health Organization on 11 March 2020. There are many types of it, such as SARS-CoV-1, the cause of severe acute respiratory syndrome, or SARS. The outbreak in 2003, it also caused by bats, same as the COVID-19. And then the virus causing the Middle East Respiratory Syndrome, or MERS-CoV, is found in camels and has continued to infect humans since 2012. And for your information, a disease can be categorized as a pandemic when the infection is passing easily from person to person in many parts of the world in the same time. Okay, next. So everyone, the whole family of coronavirus is named coronavirus because corona means crown. It looks like the way this virus look under the microscope, like there's a crown on the top of this virus. This virus covered by a little protein spike that look like a crown or corona in Latin. Some of them can cause common disease among humans to moderate respiratory illnesses. The other coronavirus also affect animals, and in the rare cases, coronavirus can jump into animal species to human population in the process called zoonosis. This form of infection can cause severe pneumonia until death. Okay, that's all about my explanation. Thank you for your attention. And the time I give back to the moderator.
Thank you very much, Miss Ira, I'm sorry, for great explanation that you given to us. Well, let's move to second speaker. The second speaker is Kadek Anggi Pratiwi Anugraha. She was born in Singaraja, 26 June 2001. Education: elementary school at SDN 1 Pancasari, junior high school at SMPN 2 Sukasada, and senior high school at SMAN 2 Singaraja. She was Bachelor of English Language Education in Ganesha University of Education. And currently, she is a Minister of Health of Republic of Indonesia. Well, we listen immediately to the exposure of the materials from Kadek, Anggi, Pratiwi, Anugraha. Time is yours.
Okay, thank you, moderator. Well, hello everyone. As previously mentioned by the moderator, I'm your second speaker. As speaker one said, Miss Ira, COVID-19 is a type of a disease that attacks the respiratory system. Now, on the nice opportunity, I will share to you about the cause of this COVID-19. Next slide, please. From its name, COVID-19 or coronavirus disease is caused by coronavirus family that commonly found in animals. But it is called that the first animal transmitted the virus to human was bat. This is also confirmed by Professor Stephen Turner from Melbourne, who believed that this virus most likely originated in bat. This mode of spread is called zoonotic transmission. Next slide, please. But in the fact is that the spread of this virus is by fellow human, between human and other human. Next slide, please. There are several things that cause a person to get this disease. 1. Not washing hands regularly. About 98% of the spread of disease originates from the hand. With an attitude of not washing hands frequently, the virus on hand will not go away. Therefore, maintaining hand hygiene is very important. Number 2, physical contact with other people in public places. Doing psychological contact such as shaking hands, hugging are also the cause of someone getting this virus. Hands are very easy to touch many things that can be contaminated with the virus. If we touch many things like eyes, nose, and mouth with contaminated hand from shaking hands, the virus can easily enter our bodies. Number 3, not use health protocol when in public places. Health protocol, such as the use of masks, is very important to use when outdoors. The use of the health protocol is also very important because it can prevent the body from getting droplets from the nose or mouth when sneezing or coughing from people with COVID-19. Number 4, not keeping your distance when in public. Close contact with people is not recommended now, because with close contact without realizing it will be very dangerous for us. In conclusion, when in crowd must be accompanied by keeping a distance from other people, wearing a mask when going out of the house, and washing hands with soap regularly. Next slide, please. Okay. The coronavirus can infect anyone, but the effect will be more dangerous and even fatal if it occurs in elderly people and people who have certain disease. Based on information from WHO and the Ministry of Health of the Republic of Indonesia, more severe symptoms and serious complications due to COVID-19 are experienced by the elderly and people with certain medical condition or disease. Okay, next slide. Okay, that's all I can convey about the cause of. Thank you for the time, and I will return it to moderator.
Well, thank you, Ms. Anggi, for great explanation that you given to us. Let's move to third speaker. The third speaker is Niloh Kadek Wiwik Kartika Dewi. She is from Kerambitan Tabanan. She was born in Tabanan 13 January 2001. Education, elementary school at SDN2 Belumbang, junior high school at SMP N1 Kerambitan, senior high school at SMA N1 Kerambitan. She was Bachelor of English Language Education in Ganesha University of Education. And currently, she is the chairman of the Indonesian Doctor Association atau IDI, Ikatan Dokter Indonesia. We listen immediately to the exposure of the materials from Niluh Kadek Wiwik Kartika Dewi. Time is yours.
Okay, hello. Good morning, everyone. Thank you for the time. It is an honor for me to be speaker in this seminar. In this next occasion, I would like to deliver the topic about the symptoms of COVID-19. So I will start now. The whole of my explanation is according to World Health Organization 2020. The symptoms of COVID-19 is divided into three types. Those are the most common symptoms, the less common symptoms, and the most severe symptoms. Okay, for the first, we will discuss about the most common symptoms. As you can see on the screen, World Health Organization admitted there are three kinds of the most common symptoms. The first one is fever. When infected, the body will make a natural response in the form of fever to fight viruses or bacteria. The normal temperature of human body is around 36 until 37 degrees Celsius, but if the temperature is above than that, it might be the first symptoms of COVID-19. The second one is dry cough. There are various types of cough, but the cough that might be the symptoms of COVID-19 is dry cough. Why? Because the cough appears suddenly without any trigger, and dry cough that infected with coronavirus is felt in the chest. The last one, fatigue. It is a little tricky to make sure that fatigue is a symptom of COVID-19, but according to World Health Organization, report that nearly 40% of 60,000 corona patients experience this extreme fatigue. This fatigue continues until the body recovers from the virus. Next slide, please. Okay, for the next is about the less common symptoms of COVID-19. As you can see on the screen, there are several less common symptoms of COVID-19, such as loss of taste or smell, nasal congestion, sore throat, headache, muscle or joint pain, reduced consciousness, anxiety, depression, sleep disorder, irritability, chill or dizziness, diarrhea, nausea or vomiting, and different types of skin. All of those symptoms are rarely found in COVID-19 patients, but there are some patients who experience those symptoms, and this research still according to World Health Organization. Next slide, please. Okay, and the next is about the most severe symptoms of COVID-19. As you can see on the screen, there are 4 severe symptoms of COVID-19. The first one, shortness of breath. Shortness of breath usually occurs a few days after initial infection. Shortness of breath refers to unexpectedly feeling out of breath. This is because low transport of oxygen. The second one, loss of appetite. Some people who infected with COVID-19 experience loss of appetite. This is because the virus has already infected our body, then makes our stomach feel discomfort. The third one, confusion. This confusion is because the lack of oxygen in the brain due to the low levels in the blood. Therefore, the brain cannot hold on the oxygen and makes us feel confused. The last one is persistent fear on pressure in the chest. The chest will feel tense and pressure. Therefore, it will be difficult for us to breathe and it will make our chest in a pain. And all of the severe symptoms are cause of the slow treatment or late treatment, and these severe symptoms can also occur if the patient who infected with COVID-19 have another congenital disease. So everybody, each individual who infected with COVID-19 may show different symptoms. And all of the symptoms that have been mentioned do not necessarily lead to COVID-19. Therefore, the thing that we can do to make sure that we are infected or not is to do a test, such as rapid test, swab test, PCR, or other significant tests. So everyone, that's all I can deliver to you. Thank you for your attention, and for the time, I turn it back to the moderator.
Thank you, Ms. Wiwik, for great explanation that you given to us. Let's move to the fourth speaker. The fourth speaker is Putu Pramesti. She is from Banjar Buleleng. She was born in Singaraja, 26 September 2001. Education: elementary school at SDN 6 Banjar, junior high school at SMPN 1 Banjar, senior high school at SMAN 2 Singaraja. She was Bachelor of English Language Education in Ganesha University of Education. And now she is the chairman of Satgas of COVID-19. Well, we listen immediately to the exposure of the materials from Putu Pramesti. Time is yours.
Okay, thank you for the times. Good morning, all of my audience. Now, in this time, I would like to share an information about the prevention and the treatment of the COVID-19. Okay, first, let's start from the prevention of COVID-19. Until now, there is no vaccine to prevent the coronavirus infections. However, several pharmaceutical companies and health institutions are working to research and develop vaccines for COVID-19. If it passes clinical trials and is declared effective and is safe to prevent the coronavirus, more vaccine will begin to be produced so that they can be given to the public. Therefore, the best prevention method is to avoid the factor that can cause to be affected with this virus, namely, first, apply the physical distancing, which is to maintain a minimum distance of 1 meter from other people, and don't go to the outside first unless there is an urgent need. And for the second is use a mask when doing activities in the public places or crowds, including when you go to the shopping for the groceries and attend worship on holiday. And cover your mouth and nose with a tissue when charging or sneezing, then throw the tissue in the trash. And for the third is do not touch your eyes, mouth, and also your nose before washing your hand. And for the fourth, encourage endurance with a healthy lifestyle, such as eating nutritious foods, exercising regularly, getting adequate rest, and also have to preventing stress. And for the fifth, avoid contact with sufferers of COVID-19, people who are suspected of being positive for the coronavirus, or people who are sick with fever, choke, and also runny nose. And for the last is, it is very important is to keep clean objects that are often touched and the cleanliness of the environment, including cleanliness of your house. And routinely wash your hand with soap and also water, or can use hand sanitizer that contains at least 60% of alcohol, especially after doing activity outside or in the public places. Okay, please go to the next slide. Okay, for people who are suspected of being exposed of COVID-19, including the suspect and probable categories, previously referred to as person under monitoring of patients under surveillance, there are several steps that can be taken so as not to transmit the coronavirus to the other people, namely, first, do independent isolations by living separately from the other people for a while. If this is not possible, use a different bedroom and bathroom than those used by the other people. Avoid sharing, eating, and drinking utensils, toiletries, and also sleeping equipment with the other people. And for the second is, do not leave the house except to get a treatment. And for the third, forbid others to visit or visit you until you are completely cured. As much as possible, do not have meeting with the other people who are sick. And for the last is, protect yourself for spreading. Wear a mask and gloves when in the public or with the other people. So use a tissue to cover your mouth and nose when choking or sneezing, then immediately throw the tissue in the trash. Conditions that require immediate treatment by a doctor in the hospital, such as childbirth, surgery, dialysis, or vaccinations for children, need to be handled differently with the adjustment during the COVID-19 pandemic. The goal is to prevent transmission of the coronavirus while you are in the hospital. Consult with the doctor about the best action that need to be done. And now, please move to the next slide. And for the last is the treatment of the COVID-19. There is not truly effective drug to treat the coronavirus infections. Treatment options will be tailored to the patient's conditions and severity. Some patients might not to be symptoms with the advice of carry out the independent house isolation protocol with still taking steps to prevent the spread of the coronavirus infections. In addition, doctor can also provide several steps to relieve symptoms and prevent the spread of the coronavirus, namely, first, reviewing several of the coronavirus sufferers to undergo treatment and quarantine at the regular hospital. And the second is provide fever and pain relief that saves in accordance with the patient's conditions. And the third is encourage sufferers of COVID-19 to carry out independent solutions and get adequate rest. And for the last is encourage sufferers of COVID-19 to drink a lot of water to maintain a body fluid level. Okay, that's all about me for the information about the preventations and the treatment of the COVID-19. Thank you for the time, and I return the time to the moderator.
Thank you very much for Miss Eka for great explanation that you given to us. And let's next move to the last speaker. The last speaker is Juliarni Nalisaputri. She from Lombok Tengah, West Nusa Tenggara. She was born in Lombok 26 July 2001. Education, MI Sirajul Huda. Junior High School at SMP and Trikopang. Senior High School at SMA and One Praya Tengah. She was Bachelor of English Language Education in Organisasi is the Social Minister of the Republic of Indonesia. Well, we listen immediately to the exposure of the materials from Juliarni Nalisaputri. Time is yours.
Okay, thank you, moderator. Good morning, everyone. Thank you very much for having me today. My name is Juliarni Nalisaputri, and it's honor for me to be able to join and participate as a speaker today, and to share my knowledge with all of you. Okay, everyone. Previously, we discussed what is COVID-19, the cause, the symptoms, and the prevention and the treatment of COVID-19, right? And now, for our final material, we will discuss the effect of COVID-19. Before that, let's try to compare how we live our daily life before this pandemic came with the current situation. We can freely go anywhere like shopping, holiday, hang out with our family, with our friends. But now, we cannot, right? Well, that's a simple example of the impact of COVID-19. So actually, the impact is any change that occurs in the situation or context. Well, now we will discuss the impact of COVID-19 from various aspects. The next slide, please. So, the first, we will discuss the impact of COVID-19 on the economy, and then the socioculture, and the last on the education. The next slide, please. So, the impact of COVID-19 on the economy. The COVID-19 pandemic has threatened the economy of people from the poor to the middle class. The threat of hunger and poverty weighs the world community, especially countries with weak economic foundation, for example, Indonesia. And 2,265 million of world's population is threatened with starvation. And logistics and trade activities are the sector that have a bigger impact. And as a result of the closure of the country, or we call it lockdown, and the closure of various companies made the production fall, rare goods and the price of goods continue to rise. Therefore, it's causing inflation in society. The next slide, please. And the second, the socio-cultural impact of COVID-19 pandemic. Apart from complicating the the economic sector, the COVID-19 pandemic also had major impact on the socio and cultural fabric of society. Social activities are limited as a condition to break the chains of spreading the virus. People are advised to attract and avoid social interaction, like social distancing and physical distance. With this change, people are required to be able to accustom to or adapt to existing changes. Changes occur in how to communicate, how to think, and how to behave. For a cultural perspective, the COVID-19 pandemic has changed the habit of direct human contact, such as the habit of shaking hands. And now we move to the next slide. So the last is the impact of COVID-19 pandemic on education. Education aspects are among the fields directly affected by the coronavirus pandemic. The coronavirus has changed the learning model from the face-to-face learning to online learning. And this online learning or distance education system is an alternative way provided by the government to continue the education even in the pandemic. Well, that's all from me. I return it to the moderator. Thank you.
Well, thank you to Miss Julie. Thank you for a great explanation that you given to us. And that is the exposure of the materials that have been explained by our speakers, which the material is delivered is so short, clear, and easy to understand. This is the time we arrive in a discussion session. For participants who have questions, can click raise hand features and please mention your name and origin. We'll be open only 3 questions. Okay, I have one question from Putu Cintya Paramitha. She is from Tabanan. And the question is, can Can COVID-19 transmitted from a person who is asymptomatic? To presenter, I think this question related to Anggi's explanation, and Miss Anggi can answer the question from Putu Cintya Paramitha. Good morning, Miss Anggi.
I'm sorry, Baga, but I think that question is related to my explanation, right?
Oh, I'm sorry, Miss.
Okay,
Okay.
okay. Okay,
This question
okay.
related. Okay.
The question is, can COVID-19 transmitted from a person who is asymptomatic, right? Okay, I will try to give my answer. COVID-19 is mainly spread through respiratory droplets secreted by a person who is coughing or has other symptoms such as fever and fatigue. Many people who are infected with COVID-19 only experience mild symptoms, especially in the early stage. Therefore, COVID-19 can be transmitted from people with asymptomatic, such as a mild cold, but they still feel well. And also, some reports suggest the people with hot symptoms can transmit the virus. I think that's my answer about the question, and thank you.
Thank you, Miss Wiwik, for the explanation. And the second question is from Juliarni. She is from Singaraja. And the question is, what the government efforts to deal with the impact of the COVID-19 pandemic? That's a clear question. Okay, I repeat the question. What the government effort to deal with the impact of the COVID-19 pandemic?
Okay, I think it's related to my material. So the question is what the government's effort to deal with the impact of COVID-19, right? Okay, that's a good question. So in economic fund, the government has been trying to maintain economic growth in 2020. In connection with this line in economic growth, the government has prepared fiscal incentive sources from the stated budget and the first zero. Then for the education, as we know, it continues even though it's still online. So as citizen of Indonesia and also a social human have no other choice to live our daily lives that are not like our habits, like wear a mask wherever we go and maintain distance and cleanliness. That way we all also have to participate in helping the government overcome the impact of COVID-19 so that it doesn't get worse. And I hope that helps your question. Thank you.
Thank you, Miss Julie, for your explanation. Okay, the last question is from Lalita Madawa from Tabanan. And the question is, there was news that COVID-19 could spread through the air. Is that true? This virus can be transmitted through the air? Okay, I repeat the question. There was news that COVID-19 could spread through the air. Is that true? This virus can be transmitted through the air?
Allow me to answer the question from Lalita. So the question Is that true the air can bring the coronavirus? The answer is no, it can. On its official website, WHO has never mentioned that the coronavirus can be transmitted through the air, and emphasizes that the coronavirus is generally only transmitted through contact with droplets from the respiratory tract of the infected person, not through the air. Okay, thank you. Good question.
Thank you, Ms. Anggi, for your explanation. Well, already 3 questions, and already the speakers answer with great explanation. Well, ladies and gentlemen, we don't realize that time flies very quickly, and the time is approaching at 9 o'clock p.m. now. Before I end the session, let me forward the conclusion of our today's session. This is the seminar for today with the topic Exploring and Understanding the COVID-19 Pandemic. There are 5 speakers who have delivered related interesting materials. In addition, there were 3 audiences who had asked questions in this seminar, and all questions were answered by the presenters. So the conclusion is coronaviruses are a large family of viruses that cause respiratory infections. These can range from the common cold to more serious disease. COVID-19 is a disease caused by a new form of coronavirus, or it also can be defined as an illness caused by a novel coronavirus, then called severe acute respiratory syndrome coronavirus 2. There are several things that cause a person to get this disease. Number 1, not washing hands regularly. Number 2, physical contact with other people in public places, not use health protocols when in public places. Number 3, not keeping your distance when in public. Number 4, the coronavirus can infect anyone, but the effect will be more dangerous and even fatal if it occurs in elderly people and people who have certain diseases. Symptoms of coronavirus disease are divided into 3 parts. Number 1, the most common symptoms of COVID-19. There are fever, dry cough, and fatigue. Number 2, the less common symptoms of COVID-19. There are loss of taste or smell, nasal congestion, conjunctivitis, sore throat, headache, muscle or joint pain, and different types of skin rash, and so on. And the most severe symptoms of COVID-19 are shortness of breath, loss of appetite, confusion, persistent pain, or pressure in the chest. Coronavirus prevention. Therefore, the best prevention method is to avoid the factors that can cause you to be infected with this virus, namely, apply physical distancing, use a mask when doing activities in public places or crowds, do not touch your eyes, mouth, and nose before washing your hands, increase endurance with a healthy lifestyle, avoid contact with sufferers of COVID-19, keep clean objects that are often touched, and cleanliness of the environment. For people who are suspected of being exposed to COVID-19, including the suspect of probable categories, previously referred to as person under monitoring or patient under surveillance, there are several steps that can be taken so as not to transmit the COVID virus to other people, namely, do independent isolation by living separately from other people for a while. Do not leave the house except to get treatment. If you want to go to the hospital when your symptoms get worse, you should first contact the hospital to pick you up. Forbid others to visit you until you are completely cured. As much as possible, do not have meetings with people who are sick. Wear a mask and gloves when in public or with other people. Use a tissue to cover your mouth and nose when coughing or sneezing, then immediately throw the tissue in the trash. In the treatment, doctor can provide several steps to relieve symptoms and prevent the spread of the coronavirus, namely, referring severe COVID-19 sufferers to undergo treatment and quarantine at referral hospital, provide fever and pain relievers that are safe and in accordance with the patient condition, encourage sufferers of COVID-19 to carry out independent isolation and get adequate rest, encourage sufferers of COVID-19 to drink lots of water to maintain body fluid levels. The coronavirus has a huge impact on several sectors, such as the economic, education, and socio-cultural sectors. Well, ladies and gentlemen, that's all about the conclusion. And I hope this session will be very beneficial for you. And please accept my apologies if there are any inconveniences along the session. Before we finish, could you please give your highest appreciation to their valuable presentation? Well, ladies and gentlemen, thank you very much for your kind attention, and thank you to the audience that you joined to today's seminar. And I close with Parama Santhi. Om Santi 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 Om. I give the moment back to MC.
Well, ladies and gentlemen, now we have arrived to the end of this seminar. We would like to say thank you very much to our lecturer, Putu Astiti Pratiwi, SPD MPD, who has attended this seminar today, and our 5 speakers, Gusti Ayu Ira Krishna Santhi, Kadek Anggi Pratiwi Anugraha, Niluh Kadek Wiwik Kartika Dewi, Putu Eka Pramesti, and Juliarni Nalisaputri for the great presentation today, as well as the participation from the audience. Hopeful, this seminar will be beneficial for all of us. We do apologize if there are some mistakes that we have done during the seminar. Thank you and see you on the next seminar.